Hello everyone. Today I'm going to be presenting on National Patient Safety Goal. My national personal safety goal is preventing infection. Preventing infection is one of the highest priority in nurses. There's actually been more than 700,000 patients that have acquired a hospital infection and 75,000 that have died from that. The types of hospital-acquired infection are Class B, which is central line associated bloodstream infection, CAUTI, which is catheter associated urinary tract infection, SSI, which is surgical site infection, and VAP, which is ventilator associated pneumonia. Hand washing is the simplest task in fighting germs and bacteria, and it can be done with soap and water or alcohol-based sanitizers. This is my case scenario. JP is a 46-year-old lady that has come in today for a cholecystectomy. JP has a history of asthma, diabetes, and hyperlipidemia. JP is very afraid of having this surgery because of the risks and complications that were given during the pre-procedure. And also, she had a family member die in the hospital from an infection. Audience, what factors can potentially put JP at risk for acquiring an infection?
Asthma, diabetes,
high cholesterol.
Okay, yes. Those things because diabetes lowers your immune system. Asthma because she is going under anesthesia and she possibly could have to be on a ventilator if she doesn't pull through during the surgery. And what type of infection may occur if improper technique is used during a procedure?
surgical site infection.
Yeah, good. I did have 3 articles on preventing infections. My first one is hand washing and reducing hospital-acquired infection. This article is about a study that was done on cardiothoracic post-surgical step-down unit patients. They actually gave the patients hand sanitizer and educated the patient on hand hygiene to see if that would help prevent the incidence of infection. They actually focus on vancomycin resistant enterococcus and methicillin resistant staphylococcus aureus, which is VRE and MRSA. They did a survey before the study, 1 month after, 2 months after, and 3 months after the intervention. And the results did show a decrease in bacteria and an infection in the patient. Case study continued. JP has made it out of surgery and is now in the post-op area. JP will be moved to a surgical floor for 24-hour observation. After several hours on the floor, JP starts to feel sick. JP calls the nurse and the nurse administers an anti-nausea medicine. Patient states that she has not been able to urinate. The nurse assesses her abdomen and patient grimaces when lower abdomen is touched. The doctor ordered a Foley catheter to be inserted. What simple task can help keep down the spread of infection?
Washing.
Yes. My second article is the appraising the literature on bathing practices and catheter-associated urinary tract infections. CAUTIs, which are catheter-associated urinary tract infections, are very costly to hospitals, and Medicare and Medicaid have been penalizing hospitals if these occur. So it is very important to keep these numbers down. And in this particular article, they actually review other surveys of practices done to help keep down CAUTIs, and they compare bath basins, chlorhexidine wipes, and just plain baby wipes. And in their study, they did find that using plain bath wipes actually help keep down infection more than the chlorhexidine wipes and the bath basins. Actually, the bath basins actually kept bacteria in them. Case study continued. JP has been in the hospital for a day now. JP starts to feel very hot and experiences weakness. Temperature taken and recorded as 101.7 degrees Fahrenheit. Nurse calls the doctor to inform about the change in patient condition. An order is given for a urine specimen and culture. Lab results received and urine is positive for bacteria. What type of hospital-acquired infection does JP have?
Gotti.
Yes, which is the catheter-associated urinary tract infection. Article 3 is called the effectiveness of a bundle in the prevention of ventilator-associated pneumonia. And ventilator-associated pneumonia can be very detrimental to patients. And it is very important that we make sure that we are keeping these patients very healthy because their immune systems are already low. Actually, in this article, they focus on the VAP bundle called Fast Hug. And Fast Hug is a mnemonic, and it stands for feeding, analgesic, sedation, thromboembolic prophylaxis, head of bed elevation, stress ulcer prophylaxis, and glycemic control to help prevent ventilator-associated pneumonia. When the Fast Hug was used, it did decrease the incidence of ventilator-associated pneumonia. Prognosis for JP, she stayed in the hospital for 3 more days to help clear up the urinary tract infection. She was placed on 2 different antibiotics. Her surgical site is healing appropriately. And just further education, it is important to follow good hand hygiene and to follow appropriate measures to help prevent the spread of infections. And these are my references. Thank you.